In this video, we are going to talk about what happens if you can't afford healthcare in America. So, before starting the video, please like this video. Do subscribe and turn on the notification to our channel for future updates. Many people in the United States have trouble coming up with the money necessary to pay for necessary medical services in this period of growing healthcare prices. Changes to private insurance plans and government programs that are intended to restrict costs may have a detrimental impact on the ability of Americans to pay for medical care. This is because it is anticipated that costs will continue to rise. The cost of health insurance in the United States can be quite high. Even if your company provides a healthcare plan for you and your family, you may still be responsible for paying significant out-of-pocket expenses. The increase in the employee's portion of premium costs was 40% from 2010 to 2020, which was faster than the growth in wages. And for the nearly half of the population in the United States that does not have access to a health insurance plan through their employment, the expenditures can be far higher. Because of this, it may be quite tempting to forego purchasing health insurance, particularly if you have a tight budget and are having trouble affording other essentials, or if you are young and healthy and don't believe you will require a great deal of medical attention in the near future. Although having health insurance is not required by law in the United States, certain citizens of certain states may nonetheless be subject to penalties if they choose to go without coverage. If you can find a method to pay for it, health insurance should be your fourth priority after a safe place to live, sufficient food to eat, and reliable transportation to your place of employment. And even if you don't, you might still have other choices. It was the intention of the Affordable Care Act to make it less difficult for individuals who lack the financial resources to get health insurance to do so. It was an effort to make healthcare more reasonable for everyone by lowering the number of people who are unable to pay their medical bills, which drives up expenses for everyone else. This attempt was made. The Affordable Care Act, ACA, imposed fines on those who did not carry health insurance in an effort to forestall situations in which individuals would be unable to pay their medical expenditures. This provision of the Affordable Care Act was nullified in 2019, and the federal government will no longer have the jurisdiction to regulate health insurance. If you do not have health insurance and you file your state taxes, you may be compelled to pay a fee. This requirement is subject to change depending on the state in which you reside. It is important to keep in mind that opting out of health insurance comes with other financial concerns, such as the possibility of being unable to pay for necessary medical care. Should you require more extensive medical attention than just routine maintenance, this could put you in a significant amount of debt. About 17.8% of adults in the United States who have credit reports have medical bills that are being pursued for collection. Because of this, you should think of health insurance as a requirement rather than a luxury item to acquire. Finding a provider that provides care at prices that are affordable for uninsured patients is, at best, difficult, and the amount of time spent waiting for an appointment with a physician who provides services at no cost or at a reduced cost can be considerable. People who have Medicaid coverage may find that their eligibility for coverage, the services that are provided, or their ability to find a provider who is prepared to accept the Medicaid price schedule are all impacted when the state faces budget restrictions. Those who have Medicare must make copayments and are responsible for the ever-increasing expense of prescription drugs. Even people who are privately insured can have trouble paying for the care they need because of growing premiums, deductibles, and copayments, as well as private plans that might not cover an adequate portion of their expenditures to guarantee access to high-quality medical treatment. Why so many Americans are concerned about the rising expense of medical care? Concerns about the high expense of medical care are being fueled, in many instances, by the high rate of unemployment as well as the uncertainty about the future ability of many more enterprises to survive the epidemic. This is due to the fact that in 2019, only under half of all Americans, or 49.6%, obtained their health insurance from their place of employment. Many people in the United States do not have access to health insurance, and as a result, they must pay for their medical bills out of their own personal funds. According to the most recent estimate, which was performed in August of 2021, as many as 12 million people in the United States had lost their health coverage as a direct result of layoffs that occurred during the pandemic. There are a significant number of younger workers among those. The pandemic had an effect on the health insurance of around 1/3 of members of Gen Z, those born in 1995 or later, and approximately 1/4 of millennials, people born between 1980 and 1994, including the loss of coverage for some members. Because of COVID-19, just about 12% of baby boomers saw any kind of impact. Those who have lost their jobs may find themselves forced to enroll in costly health care plans under the terms of the Consolidated Omnibus Budget Reconciliation Act, COBRA, or one of the state insurance markets. In 2021, the monthly cost of the national average premium for a benchmark marketplace plan is expected to be $452. In addition to the high cost of coverage, the majority of these plans also feature substantial out-of-pocket costs. Even for people who have health insurance, factors such as growing medical costs, the high cost of COVID-19 treatments, and extended wait times for claim processing can contribute to rising anxiety among Americans. In point of fact, it took customers anywhere from 5 to 10 times as long for insurance firms to pay out on claims they had submitted during the pandemic. Those who contract severe instances of COVID-19 may rack up even more expensive medical bills. If a patient has insurance and needs to stay in the hospital because of COVID, the patient will be billed an average of $38,221 for their medical care. So, that's it for today's video. What are your thoughts on our video? Please let us know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button and turn on the notification to our channel before you go. Thank you so much for watching.